Thank you for listening to GCN. Be sure to visit GCNlive.com today.
Okay, welcome back to the bright side once again. We're talking about the connective tissue, the bulk of the body. We've been talking about it for a while. We'll probably continue talking about it because in many ways, disease is a connective tissue problem. Aging is a connective tissue problem. The bulk of the body is made up of this stuff. Along with the muscle, the connective tissue and the muscle make up 70 to 80% of us. It's the beef of us. Quite literally, a steak and a hamburger are made up of connective tissue and muscle tissue. Connective tissue forms the scaffolding around which our body is put together, around which our body is constructed. If you could somehow remove the body's cells and the water, you would be left with, for the most part, the fibers of the connective tissue. We would be made up of a kind of connective tissue skeleton. Our bones are connective tissue. So you take out the cells of the body, you see this kind of fibery connective tissue skeleton or scaffolding upon which everything is constructed. Aging and the breakdown of the body is in many ways a connective tissue problem. And understanding how to build connective tissue, understanding how to support the health of the connective tissue is job number one for slowing down the aging process, even for reversing the aging process, and for improving the prognosis of many of our chronic long-term degenerative diseases. One of the most fascinating aspects of connective tissue defects or connective tissue illness, and that includes aging, which isn't technically probably an illness, but one of the most interesting aspects of how our body breaks down, whether it's due to aging or due to disease, is overexpression of connective tissue. This is a result of chronic wounding. When the body is chronically damaged, chronically wounded, one of the things that will occur is the body will attempt a chronic repair. Connective tissue secretion is a repair process. It's a repair mechanism. This relationship between wounding and damage to the connective tissue is a function of connective tissue or connective tissue's role as or connective tissue fibers' role as a repair mechanism. When the body breaks down from toxicity, from sugar, from a lack of nutrition, or low levels of oxygen, or malnutrition, connective tissue will come to the rescue as a repair mechanism. Connective tissue will act as a patch to patch up damaged tissue. And therein lies the clue to understanding many, if not most, long-term chronic degenerative diseases. It's overexpression of the repair mechanism. And I don't want to say overexpression because it really is functional. The body's just not used to being chronically damaged this way. So long-term expression of this repair mechanism, which we call fibrosis, is a major mechanism in the appearance of all chronic long-term degenerative diseases, or at least most long-term chronic degenerative diseases, and that incurs aging. If you hear the word fibrosis in your disease, as in pulmonary fibrosis, you're dealing with this repair mechanism. You're dealing with A, or first, long-term chronic damage, B, long-term chronic repair. That's what fibrosis is. It's expression of this repair mechanism in a long-term fashion, and it leads to the formation of fibers. In the lungs, it's called pulmonary fibrosis. In the uterus, it's called uterine fibrosis or uterine fibroids. In the breasts, it's called fibrocystic breasts. If it happens in the skin, sometimes we'll call it keloids. Keloids are overexpression of connective tissue fibers. Sometimes the formation of these repair fibers is called sclerosis, which technically means hardening. If it occurs in the heart, we call it atherosclerosis. It's a leading cause of heart disease. It's a leading cause of death. Hardening of the arteries, atherosclerosis. This is nothing more than a repair mechanism. By the way, the cholesterol and the calcium, or the cholesterol that the doctors attack, are really a manifestation or a function of this repair mechanism. Cholesterol deposits will form, and plaques will form, and fibers will form in the heart when the vessels are damaged. The vessels get damaged from malnutrition. The vessels get damaged from sugar. The vessels get damaged from toxicity. The vessels get damaged from long-term hypoxia or low levels of oxygen. The damage leads to more hypoxia. The damage leads to more toxicity. And you get a vicious downward spiral. The point being, the cholesterol and the fibers and the plaques that cause the atherosclerosis are a repair mechanism. They're not a bad guy. The cholesterol there is not a bad guy. It's there to repair. It's there to build. It's there to correct damage that's caused by a lack of nutrition, that's caused by a lack of oxygen, that's caused by toxicity. You can begin to see why doctors don't do anything for us. You can begin to see why the medical model doesn't work. If it happens in the spine, if this hardening happens in the spine, we call it amyotrophic lateral sclerosis, which is just a fancy way of saying that muscles aren't getting fed. That's what amyotrophic means. Due to damage, due to sclerosis in the spine. Lateral meaning the part of the spine that's damaged or that's sclerotic. Amyotrophic lateral sclerosis is just a hardening of the spine. Same mechanism, same device. It follows damage. The damage is caused by a lack of nutrition. The damage is caused by accumulation of toxicity. The damage is caused by lack of oxygen. Hello, this is all stuff we can take care of. No wonder why doctors can't do anything, because all doctors do is radiate, poison, and remove or extract or butcher through surgical procedures. They can't do anything for any of these collagen or fiber or fibrosis health challenges. If you have cystic fibrosis, genetic defects result in cellular damage, which the body then attempts to repair with the secretion of mucus and fibers, and collagen fibers. Can you begin to see a pattern here, you guys? There are the same mechanisms underlying all of the various diseases. This is the bottom line message of the bright side. The same fundamental breakdown mechanisms occur underneath all of our various diseases, and the only... This is your common sense nutritional health show. You're going to hear things on this program you don't hear on any other program. These are ideas they don't come from the internet. This is not common knowledge, even though it's common sense. And what we're doing here is we're simplifying the health and the disease process. And there's many ways to do it. If you listen to your doctor, you listen to medical professionals, they'll tell you it's very complicated. There's all these different special diseases. The only people who care about special diseases are specialists, because that's how they get paid. As far as the disease process goes, the same basic fundamental mechanisms underlie all health challenges. One of the most fundamental of these basic mechanisms is fibrosis, the formation of fibers, the formation of excessive connective tissue. Why is there the formation of excessive connective tissue? Not because the body's making a mistake, not because the body is screwed up, but because the body's attempting to repair chronically damaged tissue. Under healthy circumstances, for millennia anyway, we didn't have chronically damaged tissue. We didn't eat sugar. We didn't eat a lot of digestive toxicity or digestive toxins. We didn't have leaky gut syndrome. Under evolutionary conditions, the only things that would go wrong with us the only health challenges we had were famine, starvation, and getting eaten by a tiger. The diseases of modern civilization are long-term chronic degenerative diseases that are the result of long-term chronic damage to the body, and at least partially manifest by a long-term progressive hardening of the body. And unless we understand this mechanism, we're going to be bamboozled by statin drugs and by anti-inflammatory medication and by surgical procedures that remove fibrotic organs and fibrotic tissue, and generally the toxic, awful, anti-humanity strategies of the modern medical model. One of the most egregious, horrible health challenges associated with fibrosis is a health challenge that doctors are mystified by. They have no idea what to do with, and they come up with all of these ridiculous strategies to deal with it, and yet we keep suffering, and the condition keeps proliferating, and we get more and more people suffer from this issue. It's called Alzheimer's disease. Alzheimer's disease is the result of a secretion of a particular type of fiber, connective tissue fiber, called amyloid. And doctors and drug companies have all these strategies for dealing with Alzheimer's disease, none of which work. Now, latest is a pill that will prevent the accumulation of amyloid. This is reading from the journal Neuron. It just came out yesterday from Texas Children's Hospital and Johns Hopkins University of Medicine. Taking a pill that prevents the accumulation of toxic molecules in the brain might someday help prevent or delay Alzheimer's disease. Are you kidding me? Are you kidding me? You want to take a pill to stop the fibrosis, which the body is using to patch up damaged connective tissue. So now you're going to take a pill to stop it. According to the author of this study, Dr. Huda Zogby, professor of molecular and human genetics and pediatrics, quote, common diseases like Parkinson's, Alzheimer's, and dementia are caused by, in part, by abnormal accumulation of certain proteins in the brain, unquote. Well, what's the reason for these abnormal, and they're not abnormal accumulation of certain proteins in the brain? They're not abnormal, they're repair mechanisms. The reason for this is damaged tissue caused by sugar, malnourishment, lack of oxygen, and other toxicity. So anyway, these fibers in the brain, they're called amyloids. And this is another common way the body breaks down. It's called amyloidosis. You may have heard of this. Amyloid is derived from immune cells, antibodies, which themselves are a manifestation of inflammation. What else do you need to know, doctor? I mean, just go to your basic biochemistry book, doctor. Amyloid comes from immune cells. That means you've got an immune problem. That means you've got some kind of attack. That means you've got some kind of damage. You don't need to be a rocket scientist to understand how this goes. The connection between amyloid and chronic damage and the subsequent attempts by the body to repair itself is called amyloidosis, and it shows up throughout the body. When it's in the brain, we call it Alzheimer's disease, rheumatoid arthritis, Marfan syndrome, Ehlers-Danlos disease. These are all examples of this type of connective tissue fibrosis, amyloidosis mechanism. It can happen in the heart. They call it rheumatic fever. It can happen in the skin due to autoimmune issues. That's called scleroderma, hardening of the skin. And if it happens in the brain, it's called Alzheimer's disease. And even if you don't have a blatantly obvious disease, the aging process itself can cause the accumulation of these fibers as the body attempts to patch up chronically damaged tissue. You may not have a blatant, frank disease diagnosis, but just long-term aging involves hardening of the body. We get hard as we get old. We get tough as we get old. This is why young meat is more soft and tender than old meat. Young hens are more tender than old birds. Veal is more tender than ordinary beef. Mutton has to be slow cooked in a stew because it comes from old sheep, and it's basically inedible if you don't stew it, because it's tougher than the meat of lambs. This is part of how we age. We get fibrotic, we get older, we get hardened, we get less flexible, less resilient. This is a metaphor too, by the way. It happens mentally, it happens emotionally. We get hardened mentally and hardened emotionally. This is what old man's disease is, as I call it. When our brain gets hardened, or our mental nature, I should say, gets hardened. We're not flexible. Lack of flexibility, lack of resilience is associated with aging. Flexibility, which is a connective tissue phenomena, is associated with youth. The take-home message here, folks, is fibrosis is a common mechanism of disease. Fibrosis, and I'm including amyloidosis in this as fibrosis, it's a common mechanism of the aging process itself. And once we understand this, we will not be tricked into the sneaky medical model and the biochemical bonehead practitioners who mislead us with diagnosis, with diseases, with useless pharmacological protocols that never do anyone any good because they never address the causes, which is this long-term chronic damage that leads to the body's long-term chronic repair, which we call fibrosis, which we call amyloidosis, which we call connective tissue health issues, which we call the aging process. I got a letter yesterday from Melbourne, Australia. Quote, I am a very new distributor, I assume longevity distributor, and a chiropractor of 30 years experience. I discovered last night that an old friend of mine had been diagnosed with amyloidosis in the past year, has a pacemaker implanted, and has just finished a second cycle of chemo. I don't know why they're on chemo for amyloidosis, but maybe that's what they do in Australia. They give you chemotherapy for the fibers. I guess drug therapy is chemotherapy. Anyway, she continues. He's understandably ill, fatigued, and extremely despondent. This is what the medical model does to you. It makes you ill, fatigued, and extremely despondent. This man is in his mid-60s. He's been a personal trainer and a gym junkie. Not necessarily a good thing, by the way, if you don't know what you're doing with nutrition. Could someone please advise me of the likely biochemistry of this diagnosis and the underlying deficiencies? I do not want to offer counsel in such a serious case without understanding the biochemistry of this condition that is apparently rare. It is not rare. And if for you guys listening who understood what I just said the last 10 or 15 minutes, you could write back and answer this chiropractor. Anyway, I'll continue when we come back from our break and take your calls as well. So anyway, I got this letter from a doctor in Australia, Dr. Susie Hearn. She says she's a new distributor, a chiropractor of 30 years experience, and she's got a friend who has this condition called amyloidosis. He's been treated with chemotherapy. She wants to know who can advise her of the likely biochemistry of this diagnosis and the underlying deficiencies. She doesn't want to offer counsel in such a serious case without understanding the biochemistry of this condition. Kindly, Dr. Susie Hearn. Well, if you've been listening to this program for the last 15 minutes or 20 minutes, or if you've been listening to this program for any length of time, you know the answer. And this is what I wrote back to her. Hi, Dr. Susie. All fibrosis, including amyloidosis, should be regarded as the body's attempt to repair chronically damaged tissue. Use the Healthy Start Pack, eliminate food toxicity, apply digestive repair strategies, including taking the Longevity Ultimate enzymes with meals, the Ultimate Essence on a daily basis every day. That's a probiotic supplement. Reduce sugar intake, relax the body, activate the healing system as much as possible with massage, deep breathing, and mental and emotional strategies. You guys, if you understood what we've been talking about the last 20 minutes, this makes perfect sense to you. There's no drugs that are going to help this guy. It's the body's repair mechanism that's kicking in because the body is being chronically damaged. What's a doctor going to do for this? We got to get this out of our head that when we're sick, we go to a doctor. This is a viral meme that doesn't serve human beings. It's anti-humanity, this idea that you're sick, you go to the doctor. Now, of course, I'm not talking necessarily about, emergency conditions. I'm not talking about mechanical trauma. I'm not talking about infection. I'm talking about long-term chronic breakdown. This idea that you go to a doctor to get fixed is a fallacy that doesn't serve us. The job of a doctor, at best, is to explain to us what's happening. Doctor means teacher. This is what a doctor is supposed to do, not cut us, not surgically remove things, not drug us. A doctor is supposed to teach us what's happening in our body so we can take care of ourselves. Sometimes when I'm doing a radio program, people refer to me as doctor. Some of you guys refer to me as doctor. And sometimes if I'm doing a national show, the host will say, oh, he's not a doctor, he's a pharmacist. Well, guess what? I am a doctor because I'm a teacher. Maybe I'm not an MD, but by the definition of the word doctor, if you're teaching somebody about their body, you're doctoring. You're teaching. To be a doctor is to be a teacher. In any case, how is it that the body becomes so damaged that the repair mechanisms are chronically activated? Well, that's an important question, and that's what we'll continue talking about tomorrow. And then we'll also continue talking about glucosamine and these polysaccharides because they play a major role in supporting the body's connective tissue, including, check this out, including the connective tissue that nobody knows is connective tissue, unless you've been listening to this show, called the blood. Remember, all disease is cell disease. Behind all cell disease is dirty blood. Blood is connective tissue. Dirty blood is inflamed connective tissue. It's damaged connective tissue. And it's the cause of all disease. And we'll continue talking about this tomorrow on The Bright Side. Got tons of calls here. Time to hit the phones. 844-236-6010 is our number. Sarah in San Diego. Welcome to The Bright Side.
Hi.
What's going on?
So I was a raw foodist for a really long time, and
how long is a long time? Excuse me, I'm sorry. How long is a long time? Because you sound like you're 25.
I'm 26, and
okay.
I'd say a long time is like 5 years of just being really strict.
Okay.
And I was really, really athletic, but I couldn't ever get any muscle whenever I was doing any of my training, and I'm tall and really thin. Okay. So I started going more paleo, and then I injured myself, and I've got this like whole connective tissue issue from my sacrum down through my adductors and my knee. And it's
you're sure it's connective tissue, not muscle tissue, first of all? Or you don't know?
I don't know.
Okay, there's probably some connective tissue damage there. But in any case, what you want to start doing is rebuild, allowing the body to rebuild that tissue. And you do that from two directions, okay? The first thing is probably the most important, but I don't want to say the most important. It's as important as the second thing, and that is to eliminate damage or to reduce the flow of toxicity into the body. Okay? So first and foremost, you want, from a nutritional standpoint anyway, first and foremost, you want to look for leaky gut problems. Look for foods that are associated with digestive issues. Look for digestive issues. Look for digestive health problems. Constipation, diarrhea, loose stools, bloating, gas, heartburn. I'm talking about any digestive health issues. Look for foods that are associated with that. Find, and don't make things up, but you got to be vigilant because some of these things go under the radar, especially if you've had them all your life. So really pay close attention. I like a fast first, where you stop eating for 2 or 3 days, because then symptoms will become more obvious to you when you stop eating for a couple of days. So stop eating for a couple of days, and then start eating again, one food at a time, and looking for problems associated with those foods. When you find a list of foods that are problematic, then you're going to eliminate those foods. You're not going to eat those anymore, at least for a while, and then you'll have some foods you can eat. As you start eating those foods, use nutritional supplements that repair the gut, especially cartilage, especially bone soup, and cartilage components like high hyaluronic acid, the glucogel caps from Longevity. Anything that's got a slimy quality will help repair the gut as well. Algae, seaweed, the Fucoid Z from Longevity. Some herbs that have a slimy quality like slippery elm or colt's foot may be helpful for you. Mushrooms. Do you follow what I'm saying? Anything that's got kind of a mushy, slimy quality to it will help soothe and heal the gut. The second thing you got to do is you got to treat yourself like a diabetic, and that means go as close as you can to zero tolerance for sweets and refined sugar, and then minimize grains and flour and bread and all those kinds of foods, especially if they have gluten and you have gluten issues. The last thing, the next thing I should say, is make sure you're relaxing the body as much as possible. It heals when it's relaxed. In conjunction with the relaxation, you want to do muscular movements, but this has to be in conjunction with relaxation. Overtraining can be a problem. So doing muscular and movements, and that is what is called stretching, which isn't really stretching, technically speaking, but what they call stretching, as well as resistance training, but carefully balanced with rest. Don't overtrain. And use lots of nutrition after you work out. And by lots of nutrition, I'm talking about protein, number one. If you have a history of veganism, you could very well be underproteinated. Or you may have a deficiency in enzymes, by the way, that help your body process protein. So you want to make sure you're using enzymes with protein supplements, as well as apple cider vinegar. They all go together. I'll finish up when we come back from our break. Okay, Sarah, so don't go away. I'm Pharmacist Ben. You're listening to The Bright Side. We will return with your phone calls, more of your phone calls right after this. Don't go away. Okay, we are back on The Bright Side talking to Sarah in San Diego. Our number is 844-236-6010, by the way. Sarah, you still there? Sarah? Do we have Sarah?
I'm here.
Okay, so you're going to be building the connective tissue, the last piece of the puzzle after making sure you're relaxing the body and working the body out a little bit, especially, particularly the muscles, and also stretching. And then sugar intake, being careful of sugar intake, and then patching up the gut. The last piece of the puzzle is going to be nutritional supplements. Vitamin C is especially important. You cannot grow connective tissue without vitamin C. The ultimate example of a connective tissue disease is called scurvy. And scurvy is an absolutely horrific connective tissue disease where the connective tissue melts pretty much and you hemorrhage to death. It's just an awful illness that nobody gets anymore unless you count subclinical scurvy, which is a scurvy that you don't notice as scurvy because it's just kind of mild. And this could be something that you're dealing with if you're not supplementing with vitamin C or you're not getting enough vitamin C in your diet. So you're making sure you're using vitamin C and also essential fats. Your ultimate EFAs act as triggers for the production of connective tissue, for the repair mechanism to occur. I talked earlier about the glucogel caps. Glucogel caps contain glucosamine, which has a fluidizing effect, a liquefying effect, not really liquefying, but softens connective tissue. Glucosamine absorbs water, helps the body build the matrix around which the collagen fibers form, so making sure you're using glucosamine and cartilage-containing products as well. Get on the Healthy Start Pack. That's a must-have, as well as the other products we talked about, the Fucoid Z, the Ultimate Nightly Essence, the Ultimate Enzymes. Let's see if there's anything else I'm missing. And then you might want to consider taking extra vitamin C, although you get a big dose of that in the Beyond Tangy Tangerine. All right, Sarah, that's tons of information for you there. I hope we helped you out. Thanks so much for your call. Appreciate it. God bless you. All right, let's go to Austin and say hello to Hector. Good morning, Hector. What's up?
Good morning. How are you doing? I'm
doing good. You're not the Hector who wrote to me yesterday, are you?
No.
Okay, so I was going to read a letter from another guy named Hector. I didn't get a chance to do that. What's going on? How can we help you today?
So I got a 2-month-old who is not like any of his formulas.
Well, I don't blame him. He's smart. You got a smart 2-month-old.
Situation, breast milk isn't an option. My wife's supply never developed at a healthy level.
Okay. Well, then, with all due respect, there's not much. You don't have any really options there. You do got to find a formula, but you got to find a formula that he's going to like. There's lots of them out there. They're all crappy. But, you got to do what you can do, right? If you're not breastfed, there's no way to duplicate breast milk with a formula, but you got to do what you can do. Is he allergic to soy, or is he having problems with soy? Well, many of the formulas are soy.
We haven't tried any of the soy-based.
I would stay away from the soy-based. What are you using?
Right now, we're using the Similac Alimentum.
Yeah, that's an awful one. Have you tried any of the rice-based ones or anything?
No.
You're going to have to experiment, Hector.
I'm curious about trying the goat milk-based one, but...
Yeah, that's a good choice.
The practitioner said that could cause anemia?
No, I would go with the goat milk. I don't know why he would say it would cause anemia. It might be missing certain nutrients, but you got to do what you can do. It's not going to cause anemia. It may make him weaker.
It's kind of ass backwards to me, too.
No, it's not going to cause anemia. It may not have enough of nutritional value, but if you find a reputable formula, Hector, there's no good answers here, buddy, because we're supposed to be doing breast milk. So you got to do what you can do. The goat milk tends to be a little easier for kids to handle in general, and adults for that matter, because the milk of a goat is kind of... not similar, but it's closer to the milk of a human than cow milk is. So a lot of people can't handle cow's milk, can do goat milk, and that would be a good choice for you. As soon as he gets old enough, I don't know about 2 months old, but you might want to throw in some Beyond Tangy Tangerine in there just to make sure he's getting he's getting all of his nutrients. I don't know if I do it at this early age, but you might want to do it when he gets a little bit older. Okay, and make sure he's using probiotic supplements, baby probiotic supplements too. It's absolutely imperative that kids who aren't breastfed really focus on digestive health, because he's going to have problems that way as he gets older. He may have problems anyway, but you can mitigate some of them by getting him on a good baby probiotic supplement, or if he can do something like kefir or yogurt, maybe. Actually, if he can't do milk.
With the baby probiotic, should we just stick to whatever the directions are? Or
yeah. You can play with it. You can't really overdose him on it. You'll have to play with it and see how he does. If you notice that he has skin problems, that's a classic sign that his digestive system's starting to break down. If he's breaking out, or he's got eczema, that kind of thing.
Yeah, well, that actually got better once we got on this Alimentum stuff. He had the little spots on his cheeks, and that cleared up within like 4 hours.
Oh, well, that's good. That's a classic allergic reaction then. Yeah, you're going to have to play around with it, Hector.
It's more like GERD.
What's that?
I said now the problem is it looks more like GERD.
Oh, that's terrible. Yeah, that's terrible. That's an awful problem for a baby to have. It's awful for anybody, but let alone a 2-month-old. So don't let him give him Zantac or Tacomet. That's what the doctors do, by the way. They give, kidding, they give 2 months old liquid drugs for their heart. Did he already tell you about that?
Yeah, well, that's what they're wanting to.
No.
The next step.
No, this poor baby. No, don't do it. Work on the digestive system and use the symptoms as a guide.
Okay.
All right?
All right.
Thanks, Hector. Take care, man. All right, Tony, Austin, Texas. Good morning. What's up?
Good morning, sir. How are you?
I'm doing good.
Good, great. We love your program.
Thank you.
I have a brother that he's 60, and his primary doctor was telling him that they wanted his prostate level was like, I think when he had a blood test, it was like 4.3. And since then, been listening to your program. He's changed his diet somewhat, and he was taking the cannabis oil from the health food store, and more vegetables and things like that, and the longevity pack, and it went down to 4. And they're still wanting him to have a biopsy, and I was advising him against it. And what he's going to do in the meantime, and what we found out, is cut out the beef, the pork, and the lamb, things like that.
What are his symptoms? Does he have symptoms?
He does not.
I don't know. The PSA screenings, is that what you're talking about? The PSA you're referring to, I assume. They're not buying it. There's too much there's too much trouble with the PSA test. I'm not buying it. You know, the whole PSA thing, blood screening and all that stuff. Let's look for symptoms. Is he going to the bathroom a lot?
No, sir. He's taking the super prostate from Longevity product.
And so the only way he knows he's got a prostate problem is because of the PSA.
Because of the PSA test, exactly.
I'm not buying it. You know, the PSA is not. Even the guy who invented the PSA has problems with the test. I forgot the guy's name. I was just reading about it, but he's even on record as saying that there's false positives and people have cancer. People live fine with so-called prostate cancer. Do you know up to a third of autopsies show prostate cancer in men, although only a very tiny fraction of them die from prostate cancer, like 1% die from prostate cancer, but a third of autopsies show prostate cancer. Show the signs of prostate cancer. I'm not buying it. Go by symptoms. Is he overweight? Is he?
He's about 6'3", and he's about 250.
I wouldn't be treating a PSA score if it was me. That's not to say he doesn't want to be doing things, the normal things to stay healthy. Reducing sugar intake, making sure he's processing fats correctly, using fat-soluble vitamins. Everything we talk about here in the program, but I wouldn't be treating the PSA, that's for sure. Google PSA. Google PSA cancer screening hoax or PSA cancer screening doesn't work. Just Google it. There's zillions of things will come up on that. All right.
Okay. In addition to that, sir, I was also telling him that if he had an infected prostate and they did a biopsy, wouldn't that expose the rest of the body for
biopsies are always a problem. Yes. You got to be very careful about biopsies. What's that?
Cutting into him.
Yeah, exactly right.
Cutting into him.
Exactly right. So, if you got positive results, false positives or false negatives for that matter can occur with this PSA test, and that basically makes them useless. Because then you're going to get drugged and you're going to get dosed and you're going to get cut up and you're going to get you're going to get biopsies to treat a number that could be false positive or false negative. I got a problem with the PSA test. All right?
Okay, thank you so much.
Gotta move. Take care, Tony. Okay. Thank you so much. Hope we helped you out. Truth Raider, can you do something quick for us?
Happy Halloween, Dr. Ben.
Happy Halloween to you, Truth Raider. But we're out of time, buddy. I just want to say hello. So,
Absolutely.
Hello. Talk to you later. All right. That was Truth Raider, briefly. Anyway, thanks for listening, friends. I'm Pharmacist Ben. If you like what you hear, tell your friends. We're on the air Monday through Friday, 8 to 9 Pacific, 10 to 11 Central Time. Check out my website, brightsideben.com, for more good health information. Also, criticalhealthnews.com and pharmacistben.com. And check out our Truth Skin Health products at truthtreatments.com. Have yourselves a beautiful, spectacular, awesome, wonderful day. We'll talk to y'all later, folks. Bye for now.